And I would now like to welcome Sri Lav Verma, Secretary to the Government of India, Health and Family Welfare Department, for his address on this occasion. Sri Lav Verma, please.
Shri Jagat Prakash Nadda ji, Honorable Union Minister of Health and Family Welfare, Shri Nitin Patel, Honorable Cabinet Minister of Health, Government of Gujarat, Shri Atma Ram Bhai Parmar, Chief Whip of Legislative Assembly, Government of Gujarat, WHO Representative to India, Dr. Nata Manabde, Mr. Anil Mukim, Principal Secretary Health, Government of Gujarat, Mr. J.P. Gupta, Commissioner Health, Government of Gujarat, and friends. It is indeed inspiring to be in a state which has given us two lions and legends in the shape of our father of the nation, Mahatma Gandhi, and the Iron Man of India, Sardar Vallabhbhai Patel. Gandhiji's words, "You must be the change you wish to see in the world," and Sardar Patel's message, "Strength is life and weakness is death," should guide us throughout our lives and remain emblazoned in our minds and hearts. Technology, innovation, and an enabling environment, all three are critical in assuring health for all. As Subroto Bagchi has said in the anniversary issue of India Today, and I quote, "Technology is not just about the utility it delivers. It has multiplicative powers and it is inherently transformative in nature. There is an alchemy to it," end quote. However, we have to be careful and realize that technology is a double-edged sword. In the medical field, it can as easily lead to sex determination and female feticide as to telemedicine and mobile health. Innovations, there have been aplenty in both the private and public sector, and in our ministry, we hold a yearly conference in which states share their innovations and their best practices so that learnings are available to all. And finally, an enabling environment in terms of laws, regulations, a conducive administrative environment, an efficient and effective work culture is of utmost importance in instilling confidence in the medical community. In the public sector, I wish to talk in some detail about three important technical innovations which will function as enablers in delivering healthcare to all. The first of these is Skillkari. This is an audio-based mobile service that delivers weekly messages to families about pregnancy, childbirth, and childcare. Each pregnant woman or infant's mother would receive weekly messages relevant to the stage of pregnancy and age of the infant. The message would reach the targeted beneficiaries from the 4th month of pregnancy, which comprises 26 messages, until the child is 1 year old, 52 messages. So basically, we cover the antenatal care right up to the immunization. So far, a similar service is live in Bihar, but it is a paid service and we hope to make it free. From October the 2nd, 2014, 18 audio messages in the local Hindi dialect under Kilkari are being sent to the pregnant women and parents of infants in the high priority districts of UP, Bihar, and MP from the existing Mother and Child Facilitation Center. You all are aware that 24 states have already reached TFR of 2.1, but it is the high focus states of UP, Bihar, Jharkhand, Madhya Pradesh, which still have a high TFR. So our focus is on these high priority states. Presently, it is possible to send only 6 lakh messages per month. However, after the establishment of the National Data Center, weekly messages would be sent to over 4 crore pregnant women and parents of infants annually. And we hope to see that our routine immunization, which is 65% at present, it goes up to at least 80% in the coming few years. Next, let me introduce you to the Mobile Academy. This is an anytime, anywhere training course that can train hundreds of field-level workers simultaneously via mobile phone. Once registered, frontline health workers can access the 190-minute course via a mobile short code. They can then complete the standardized course at their convenience. Now, what is most important is that digital bookmarking technology enables users to return to the course where they left off and to complete it as quickly or slowly as they like. This is, I think, the great advantage of Mobile Academy, because everybody can complete it at his or her own pace. It is not like classroom instruction. You can bookmark it wherever you left off. When you get time, you can go back to it and learn at your own pace. The course is divided into 9 chapters, each containing 4 lessons. At the end of each chapter is a quiz. After completing the course, health workers with a pass score of 50% receive a printed certificate of completion from the government. So far, the service is live in Bihar, supported by the Bill and Melinda Gates Foundation. Recently, we had a presentation before the Honorable Prime Minister, and he has suggested that we should have similar courses for children also from class 8, 9, 10, so that we can spread health awareness. And he has given us a very good idea of involving the medical colleges, so that children are given instruction about disease control, about sanitation, about hygiene at the right age. And as they progress in life, they are able to imbibe healthy lifestyles. Finally, a word about the mobile Kunji. This is an audio-visual job aid that field-level workers, Ashas and Anganwadi workers can use during counseling sessions with rural families. It consists of an audio-based mobile service and a printed deck of 44 illustrated cards on a ring which communicate essential information relevant to different stages of pregnancy and age and health of the infant. The deck of cards is designed to be portable and durable. Each card carries a unique 7-digit number, short code, that can be dialed on the Asha's mobile phone. The Asha dials the short code and puts her phone on speaker mode so that both she and the family can hear the audio content, or simply hands the phone over to the pregnant woman to listen. The content, which is delivered by Dr. Anita, a woman doctor character, the voice of authority, designed to be engaging and conversational to reinforce the health message presented on the card. Calls to Mobile Kunji can be made from any mobile handset and do not require any special or bespoke software or applications. Calls are toll-free for field-level workers. This was supported by the Bill and Melinda Gates Foundation and developed by the BBC. The Kilkari and Academy would be rolled out nationwide, and we are in the process of doing so, while Mobile Kunji would be rolled out in those states that demand it. BMGF will provide the MOTEC, which is the mobile technology platform that would support the 3 applications, content and application, free of cost. As you all know, MMR and IMR, these have been the 2 basic challenges which we have been facing. And after the NRHM was rolled out in 2005, we've made very good gains on both the fronts, but still there's a very long way to go. If we compare 1990 with the present day and age, our MMR in 1990 was as high as 560. It was higher than the global average, but now it has dropped below the global average. In 2012, it was 178. Similarly, our under 5 mortality rate and also our infant mortality rate has come down significantly. And with the aid of these technological devices, we hope to not only reach our MDG goals, but to bring them further down drastically in the coming 5 years. Now let me turn to the private sector. The private sector has been redefining the healthcare system through process and product innovations. Narayan Health, Arvind Eye Care, Lifespring Hospitals, LV Prasad Eye Institute, Janani, etc. have emerged as excellent case studies for providing affordable and quality health care. Narayan Health performs around 8 times more heart surgeries per day than any other hospital chain in India, at less than half the price charged in any other private hospital. Dr. Devi Shetty of NH has been called the Henry Ford of heart surgery by the Wall Street Journal. At NH, each surgeon performs 400 to 600 procedures annually compared to 100 to 200 by US surgeons, and it charges 3,000 US dollars on average for open heart surgery against $20,000 to $1 lakh in the USA. So you can see not only the price difference but also the number of operations is so much larger. By driving huge volumes, NH has managed to drive down the cost of healthcare, and 30% of its patients receive free or subsidized care. Arvind Eye Care, I hope most of you have heard about it. They have perfected the manual small incision cataract surgery technique, requiring less sophisticated equipment and less seasoned surgeons with cheaper lenses. It manufactures high quality intraocular lenses at fractional cost compared to buying them from international suppliers. At Arvind, each doctor performs 1,000 to 1,400 eye surgeries annually compared to 400 internationally, and around two-thirds of its patients receive free or subsidized care financed through full fee services provided to wealthier patients. So you can see how cross-subsidy is working, and also how this huge numbers, the volumes in India, they are being met through very innovative techniques. Now let's look at LifeSpring hospitals. That is actually a PPP model. Through low-frills hospitals, they provide quality care in semi-urban and rural areas to lower-income women and children in Hyderabad. It is a 50-50 equity partnership between Hindustan Latex Limited and the Acumen Fund, which is a US-based non-profit global venture philanthropy fund. LifeSpring has demonstrated exceptional management principles with entire focus on one particular niche, which is maternal care, and thus has been able to optimize its resources and processes and charge 30 to 50% of the prevailing market rates. Finally, I would like to mention Janani, which operates through a network of 185 Surya clinics in Bihar, Jharkhand and Madhya Pradesh, and focuses exclusively on family planning and abortion product services. Over 15.5 crore couples have benefited from their products and services. So these are a few examples. There are so many others, and Sangeeta Reddy ji is here. Apollo Hospitals has also pioneered a number of innovative techniques and technological innovations. So it would take actually the whole day to list them out. But what I'm trying to say is that both the public and the private sector, they have contributed in no small measure through innovative technologies to addressing problems of healthcare. I will end with a vote of caution and a caveat, and that is that technology must be the handmaiden of medicine and not the other way around, which harks back to what I said earlier, that it's a good servant but a bad master. Over-reliance on technology can not only raise the cost of healthcare, but also runs the risk of disempowering our doctors to the extent that they cannot diagnose disease without a battery of complicated tests. The cost of technology and innovation must be low so that all sections of the population can benefit therefrom. Such advancement must therefore be frugal. We talk of frugal innovation, by which I do not mean cheap and of low quality, rather I mean full value for money, in tune with the requirements of the country and based on the values espoused by the greatest son of this land, Mahatma Gandhi. That is the challenge I call upon all of you to meet. Thank you.
Thank you, Shri Verma. He has very rightly pointed out the opportunities in innovation, both in public sector as well as the opportunities where private sector has used technology to bring down the cost and maintaining quality. And he has very rightly mentioned a note of caution on the use of technology, which can be a double-edged sword, as he mentions. With that, we are now about to release two books. One is showcasing the health department of government of Gujarat, and second is on the medical tourism opportunities in Gujarat. I would request the help to give a copy of these books to our dignitaries on the dais, and we would release the books.
લેટ થઈ ગયો બે રાખો વાંધો નહીં અહીંયા બાર ગયું તો
Thank you, sir and madam. Uh, we now come to the point where we will have a keynote address by Shri J.P. Nadda, Honorable Union Minister of Health, Government of India, for his views on the today's theme of health for all, leveraging technology, innovation, and enablers.
Shri Nitin Bhai Patel, Minister for Health for Government of Gujarat, Shri Atmaram Parmar ji, Chief Whip and associated with health activities, Dr. Nata Madmade, WHO representative, representative to India, Universal Healthcare, Love Verma, Secretary Health, Government of India, Shri Anil Mukim, Principal Secretary, Government of Gujarat, Shri J.P. Gupta, Commissioner Health, Government of Gujarat, distinguished members on the dais, luminaries representing the health field, members of the media, print media and electronic media, and dear friends. First of all, it is indeed a matter of great happiness for me to address and to be with this august audience who represents the health field. And in this vibrant Gujarat is global summit. We are all here to discuss about the health issues. While I was sitting here, I must admit that this is my first occasion to participate in this global summit. While sitting here, I was thinking that how our Honorable Prime Minister in 2002, 2003 must have visualized as a visionary to see to it that how we, by interacting and coming together, addressing the issues which the country or the state faces, we should have regular interaction, and that is how it started the vibrant Gujarat. We have gone a long way. 7 Gujarat's vibrant summit, Gujarat vibrant global summits have taken place. This is the 7th one. From a small vision, it has come to a reality. And it is now not only a forum for Gujarat, it is now a forum for the country, India, where interaction is taking place and it is taking a vision. So first of all, I would like to congratulate our visionary leader, the Prime Minister, Shri Narendra Modi, who happened to visualize some 12 years ago how we should go ahead. And this Gujarat model has now converted to be a model of India. We are here not only to discuss about Gujarat, because Gujarat has taken a lead, but here now we are to discuss how we can address the problems related to health throughout the nook and corner of the country, to the remotest, to the vulnerable, to the poorest. And that is why I must also congratulate the organizers for selecting the subject, health for all, universal health care, I must also congratulate for deep thinking of innovations, technology, leveraging innovations in technology and methodology. This is a very relevant subject. We all want to do something good, but how to do it? How it should reach to the end person? How it should reach to the needy? That is what is needed to be discussed. I am very hopeful that the luminaries, the health luminaries are here. You have got much more vast experience than me. I being the minister, of course, we are there in policy making, but we, or I, or our community, without you, without your inputs, is meaningless. Your inputs are needed, your valuable suggestions are needed, and on those suggestions, we can formulate policies and we can go ahead. You'll be happy to note that in 2002, we had a national health policy, and now in 2015, we are again, because now a pretty long time has passed away, we have gone through the health policy. Some changes are needed, and it was our commitment. Shri Narendra Modi ji wanted that we should make health more relevant, more meaningful, more delivery oriented, and that is why we have gone for a new health policy. Now it is in the public domain. Till 28th February, we are inviting suggestions. We need your earnest suggestions on all accounts. We have talked about many issues. We have talked about universal health assurance. Now, what do we mean by assurance? Assurance means only giving financial help? Or assurance means giving the best delivery to the person? These are the issues which we have to interact and we have to discuss. Friends, recently our Prime Minister, in Science Congress, he talked about the development of the country is not only by development of the science, but the development of the science should take place which should deliver to the poorest, to the vulnerable, and to the last person of the society. Then only science and development goes together. Keeping this factor in view, I must here reiterate that whatever we think, it should be for the poorest, for the remotest, and for the vulnerable. That should be our higher priority. Just now, Dr. Nata Membade was talking about universal services. I appreciate. She has got a deep sense and deep understanding about India and about Indian problem. She has talked about universal services, and at the same time she was also talking about preventive part. I must associate with her, and I would also like to tell that on 25th December, the birthday of Shri Atal Bihari Vajpayee ji, we have launched a program called as Indra Dhanush. It's very sorry to note that in the universal immunization coverage, approximately 90 lakh children, 17 of them totally uncovered, and approximately 70 lakh partially uncovered. So we have decided that in the month of March till June, we'll take the first phase, where we would like to concentrate in 201 districts in this Indra Dhanush program, out of which approximately 80 districts are most needed, and they are the priority areas. And among that also 40 are in Uttar Pradesh. So we have mapped all that, and in the first phase, we are going to give them 7 immunization program for polio, for whooping cough, for typhoid, for measles, for hepatitis B, for diphtheria, and for tetanus. Now, I would like that we should understand why this partial coverage has taken place, how technology can be involved in it, how we can make it more meaningful and realistic. It should not be that Indra Dhanush should also be one of the programs, as many programs have been undertaken. It should be a program where technology, where innovation is taken into consideration, and all the inputs should be taken so that this converts into a reality. And for that also I would like to have your inputs. As far as the innovation part is concerned, Innovation is not only in technology, innovations is also in appliances. Not for high-end appliances only, but for small kits also innovations are needed. For drugs, innovations in methodology also. Innovations in improvement of best practices and best systems also. We need to innovate systems which really work and which really work in Indian conditions. That is what we have to innovate. We have to innovate for monitoring, tracking, and for dissemination of information. That is most needed. Now, when we talk about technology, we think innovations means only high-end appliances. Our country needs certainly that innovations should take place for high-end technologies, for high-end appliances. But we also need innovations for smaller kits, like coming to know about measles. If a patient has got measles, what is his hemoglobin? What is his? What are the infections which he can carry, and how it can be detected? And it can be very small innovations, but very meaningful innovations, where at the grassroots level it can be utilized. What is his position of the blood, the iron in the body? These innovations are also needed. So I'll say that we should also consider about making of basic kits which help the poor and in the rural area which can be utilized. That is what, and that should be low cost also. Innovation in the pharma sector, when we talk about, we are good in generics, but we also should concentrate on innovating new drugs, and that to low cost. These are the areas where we have to work. It's not an example, it's not a reason to have a competition with international health issues which they are addressing. We need new drugs which is needed in Indian context. So innovation can take place in that also. I come from Himachal. Nobody knows. Our people suffer from scrub typhus. It's a very special kind of disease which takes place in hilly areas in scrub forests. So now, any drug which is being invented in Europe or in England or in West is not going to help us. We need innovation for scrub typhus, and that is the Indian need. So we should also think in these terms, that innovations should be for the need of the country, and there should be always a balance between the medical need and the commercial need. There are many drugs which may not have a very commercial viability, but as far as the need is concerned, it is very important. So we should also think in those terms. If we talk about IT, of course, we have tried to empower the ASHA workers by using IT, a unique methodology. Gujarat is an example where grassroots level, the ASHA workers have been given the IT technology, and because of that IT technology, we are able to monitor, which was being told by Love Verma, called as Kilkari. It's really, I will say that it is really a boon for humanity. ये वरदान सिद्ध हो रहा है. देश की स्वास्थ्य जगत को परिवर्तित करने में ये एक बहुत बड़ा वरदान सिद्ध हो रहा है. So we should think in these terms also. Dissemination of information. Medical education is also one field where IT can do wonders. We can make it education cheap. We can make it more accessible, affordable, and the dissemination of information will be certainly very good in this field. So we should also think about it. And as far as the IT is concerned, it is very useful for delivery, for end delivery, for tracking, for monitoring, mother and child health care, for IEC. These are the areas where IT can do wonders, and we should see to it that how we can utilize this field. One thing I would like to say, that we talk about big things, but when it comes to implement, there is always a bottleneck. And the bottleneck is the political neck. I am here not to give you inputs. I am here to give you, on behalf of our Honorable Prime Minister, a political commitment that whatever you do, we will make it a reality. That is what I would like to say. I can assure you that that bottleneck is not going to remain. It's going to be taken care, and we have to also see to it that whatever we innovate, we talk in terms of product-based. An innovation comes, he talks about the product, and we always talk that this product can help in this way. But we don't link it from where to start and where to end. So the product remains a single feature. I don't know whether I am able to explain it to you or not. But somebody comes and talks about telemedicine and says that this telemedicine is going to help. I say how it is going to be converted into a reality. Explain me that. Your telemedicine system is there, your doctor is there, the patient is not there. When the patient is there, the doctor is not there. So if you do not link it, the whole product becomes just a matter of exhibition, not a matter of reality. Just a matter to exhibit. If you want to make it a reality, you have to also take care that the product should be made and it should be seen to it that where from it starts and how it gives the end result. So we should not think in piecemeals, we should think in totality and see to it. I've asked my departmental people, you have done wonders, but tell me one example where telemedicine is working. If the patient gets the confidence that why should I go to a district hospital? My primary health center is going to take care, and if I go there, I'll get the result from the specialist. Telemedicine is successful. But if you do not have that system, the whole product is only a matter of which you are going to exhibit. So what I would like to suggest is that when you think, I know that your inputs are great. I know that you talk about innovations. But do not think only of the product, but think how it can be converted into reality. And those bottlenecks should also be taken care of. India has got a lot of strength. We are a youth force, IT savvy, and we have got a network of research organizations. And they have done a wonderful job. We need to integrate with them. We need to see to it that we work hand in hand. We can get inputs from them. These organizations should not work in isolation. We should not say that this organization is saying X, Y, Z, and another organization is saying something A, B, C. We have to integrate. ICMR may be talking something that should be talked by everybody. Or ICMR should take care that what the people need, that should be taken care. We have to synergize. We have to see to it that all these research organizations come hand in hand and work together and see to it that we work for the humanity. And if India can do, and I certainly have got the confidence that India will do wonders in the field of health. And if India takes care of health, world health situation is going to improve. That is also one of the factors which we have to take care. So, all keeping this in mind, I would like to say that indeed it has been a great opportunity for me to interact my stray ideas with you. But whatever in a month and a half which I have been in the office, whatever I could gather and whatever experiences I had in my past as a health minister of my Himachal state, I have tried to interact with you and see to it. And I am not here to give sermons. I am here with you, along with you, to fight and see to it that it becomes a reality that we give a universal health care. Thank you very much.
Thank you indeed, sir. It was very heartening to listen to the political commitment which the Honorable Minister has offered. As being one of the chief enablers himself, we look forward to a lot of support from the Ministry of Health, Government of India. With that, we come to the last of the presentations.
To give the vote of thanks, I request Dr. Vihang Majumdar, HOD, PSM Department, Medical College, Vadodara, Dr. Vihang Majumdar.
It is my honor and privilege to offer a vote of thanks to the honorable dignitaries for today's inaugural session. I would express my gratitude to the Honorable Minister, Shri J.P. Nadda, for being here with us and sharing his vision for the future of health and the technologies which we expect to come. I would also like to express my heartfelt thanks to Shri Nitin Bhai Patel, Honorable Cabinet Minister of Health, Government of Gujarat, for being with us and being very supportive for organizing this seminar. I would also like to express my gratitude to Shri Atmaram Parmar, Parliamentary Secretary, Government of Gujarat, for being with us on this occasion. I would like to also be grateful to Dr. Nata Menabde, World Health Organization representative of India, for being with us on second consecutive Vibrant Gujarat, having been here in the last Vibrant also. We would now also express our gratitude to Sri Lav Verma, Secretary Government of India, Health and Family Welfare, for his vision for the health department in future and being with us on this occasion. I would also like to express my gratitude to Shri Anil Mukim, Principal Secretary to the Government of Gujarat, and Shri J.P. Gupta, Commissioner of Health, Government of Gujarat, for being on this occasion. We would like to start the plenary session immediately after this. May I request the dignitaries to come and join the audience while I invite the members who will be there for the plenary session. I would request Shri Anil Mukim to continue. I would invite Mr. Louis George Arsenal, Country Head UNICEF, and Dr. Sharad Sapra, Director and Principal Advisor, Global Innovation Centers, UNICEF, Professor Alain Lebrick, Director M Health Initiative, Johns Hopkins University, Baltimore, USA. I would like to invite Professor Pranab Gupta Kumar Datta, Head Medical Service and Technology, IIT Kharagpur. I would like to invite Ms. Sangeeta Reddy, Joint Managing Director, Apollo Hospital Enterprise Limited, and Mr. Pankaj Patel, Chairman and Managing Director, Zydus Cadila, Ahmedabad.